Hi, I'm Marla with Clinical Cannabis Today, and we're here in Tucson at the Patients Out of Time conference. And I have the great pleasure to introduce you today to Moti Moshiah, who is the Deputy Director for the largest mental health hospital in Israel. Thank you so much for being with us today. I have a couple of questions. Can you tell us a little bit about the medical cannabis program that you have in your country?
Actually, right now we have about 8,000 people who get cannabis as a treatment. We began with 60 patients only as a compassion treatment for cancer 5 years ago. And we believe that in 2020 we're going to have about 30,000 people who will get cannabis as a treatment. We treat people with cancer, with pain, with neurological disorder like MS, like Tourette, people with Crohn's disease, people with post-traumatic stress disorder, sometimes people with Parkinson's disease, and that's it.
Wow. And how do the patients go about getting the medicine and being qualified to be able to be a patient to receive the medicine?
Actually, right now, only there is 2 doctors in Israel, me and another one, can be signed and confirm the medical cannabis. And the patient go to a doctor, for example, from neurologist, and he give the recommendation. I have to see the recommendation and to sign up that it's okay. Then the patient go to the inside the hospital and he can receive the cannabis. We usually begin with amount of only 20 grams, and the average amount is between 60-65 grams for a month. The license are the big license are
It's okay.
Okay.
How much they pay to
give Okay.
the recommendation,
Okay.
and then how much
Okay.
do they pay for the medicine?
They don't pay nothing for the recommendation. They pay $100, and never mind if they get 20 grams or 80 grams. Actually, everyone have to pay $100 for 1 month of treatment.
And that's up to 80 grams in a 30-day period.
Up to 100 grams.
Wow. Wow.
So actually, it doesn't matter if you get 20 grams or 100 grams, you will pay $100.
And is that annually that the patient has to come in and get the recommendation, or do they have to come back and visit the doctor monthly, or how does that work?
He's working. The first 2 visits are in after 6 months, and the second one after 6 months, and then you got license for 1 year.
Wow. That's great. And is it only your hospital where they can get the medicine dispensed from, or is it all the hospitals in Israel?
Actually, only in our hospital, and there is one of dispensary as a shop in Tel Aviv outside the hospital. But actually, all the other farmers bring the cannabis to the hospital, and they distribute the cannabis there.
Wow. So what do you think that the future is going to hold for medical cannabis with the growth from 60 patients to 8,000? Where do you think this is going to be going for the medical industry?
Actually, as I told you, we believe right now that in 2020 there will be around 30,000 people who will receive cannabis. We know that people that receive cannabis, some of them reduce the medication that they get, like painkillers, like antidepressants, like sleeping pills, or even antipsychotic pills. So we see that there is some kind of reduction of the medication, but we don't know the real assess the cost and use of those medication. And right now we do a retrospective study to see how much the reduction of the medication.
And the medication is being reduced, and it's being substituted by clinical cannabis with most of your patients. Is that what's happening? Is that what you're seeing?
That's correct, exactly.
And what's the percentage?
Actually, we don't know yet. We do right now a retrospective study to see the percentage of the reduction of the medication.
Great. So how many farmers are there out there growing medical cannabis, and what type of is there any type of regulation, or is there any type of like study, or is there any type of what would it be? It would be an quality of the medicine. Is there any type of government that is regulating that?
Right now, actually, it's a problem. We have 7 farmers, and we randomized tasting the quality, but actually we don't have something well organized to see the exact amount of the percentage of the THC or the CBD, etc., etc.
And how many of the patients in the hospital and the ones that you're seeing, how many of them are you treating with edibles? Do edibles come into play at all? With edible would be like a tincture or a brownie or a cookie.
Actually, I don't know the percentage right now. We use oil, we use cookies, but I can't say the exact percentage of the people that use cannabis like this. I can tell you that, for example, in Jerusalem, in the area of Jerusalem, people get only oil, no smoke cannabis, just oil.
Wow. And so can they get oil also at the hospital? Of course. And okay.
Of course, even at the hospital. I mean, they come to the hospital, but they are not patient of the hospital.
Right. They just
They come from outside that just to receive the cannabis, and that's it.
Okay. And so when they come to the hospital, is there any type of a process where the government is going to be able to track them for that? And what type of process is that?
Of course, we have registration of each of them. We have an office with 2 secretary, and there is security guard that look the license if it's according to the amount of the cannabis that they get.
Okay, that's great. And is there anything else that you would like to tell our viewers about your cause and all the time that you've put into this? We would love to hear what your thoughts are about the future for you and your country.
I Can you repeat it?
Yes.
I don't understand the question.
Okay, I'm just wondering, is there anything else you'd like to tell the viewers about what's important to you for this cause?
Okay. We can see that cannabis help people dealing with pain, with cancer, with mental disorder like PTSD, like Crohn's disease, like HIV, and we found that it's very helpful.
That's great. Well, thank you so much for taking the time today, and it's been a pleasure meeting you, and thank you. Thanks for watching.